Thank you so much. This is Dr. Dara Thompson. I'm the chair of the Naturopathic Medical Committee. And at this point, I would like to call to order our November 11th, 2022 meeting. And Rebecca, can you do a roll call to establish quorum?
Great. Thank you so much, President Thompson. And so I would like to go ahead and take the meeting roll call and just to let everybody know, this is for the November 10th meeting. Dara's trying to get us onto Friday already, which I don't mind. So Dr. Dara Thompson.
Present.
Okay, thank you. Dr. Greta D'Amico.
Present.
Thank you. Dr. Vera Singleton.
Present.
Thank you. Dr. Bruce Davidson.
Present.
Great, thank you. And Dr. Meena Yoon.
Present.
Great, thank you so much. Dr. Deparshi Mukherjee will be absent with cause today. And it looks like we have a quorum.
Thank you so much. For those of you who didn't hear earlier, we just wanted to let people know that Dr. Virginia Osborne has kindly offered to be present for our review of agenda item 5, the IV therapy regulations. So when she joins us, we will go to that agenda item. Is Dr. Osborne present at this time?
Not yet.
Okay, so we'll just move forward with our agenda as it's listed, knowing that we are going to pull agenda item 5 forward when Dr. Osborne is present. At this point, we are going to move on to agenda item number 2, which is public comment for items not on the agenda. Moderator?
Thank you. We are opening up the WebEx Q&A feature to facilitate public comment. At this time, there are no members of the public in attendance, but if there were, they would have the opportunity to type the word comment into that text box and then click send, and we would call on people in order. Shall I close this as there are no members of the public present in the meeting?
Please do, thank you.
You're welcome.
Wonderful. So then we are able to move on to agenda item number 3, which is the review and possible approval of the July 14th, 2022 committee meeting minutes. Everyone should have received a copy of those and been able to review them. At this point, I'm going to ask if there are any edits or questions about those.
This is Dr. D'Amico. I have a few minor items. I was waiting to see if anybody else might volunteer.
We depend on you, Greta.
Okay. Most of these are just grammatical stuff. Agenda item 4, third sentence. Dr. Montez explained the process for the review of national exam, which includes, with an S, and I'd probably say a psychometric evaluation, but unless everybody knows it's the one, that's fine. I'll wait to hear that Rebecca's got it before I move on.
I'm taking notes as you speak. Go ahead.
Okay, second paragraph, just put a comma after associated with this review, before however.
Okay.
Agenda item 5, second paragraph, Genesis Medical College of Tustin. California is abbreviated, should be, I think it's, I don't know if it's capital small. It's capital C small a. I don't know if it should be how it should be.
Ah, gotcha. Yes, you're right.
Okay, and then on the last sentence on that page, I would just cross out finally. So as outlined in the Naturopathic Doctors Act and missing CVs, and just get rid of finally.
Okay, got it.
Then In, let's see, all the way down, I'm going to say page 7. We're talking about the Sunset Review Bill and changing the name of the committee to the California Board of Naturopathic Medicine, where it's abbreviated CBNM. But in the following 2 paragraphs, it's abbreviated NMB. Are we allowed to do that?
Hold on one second.
Yeah.
So NMB. Well, okay, so no, it should be CBNM. However, this information was actually taken from one of the analysis, and they continue to call us NMB. So I will make those changes just so that it's all fluid throughout.
Or we can just put an explanation in parentheses after NMB what it stands for. Either way.
I think it's fine. We could just change it to what it should be. Thank you.
That's all I have. Thank you.
Perfect. Thank you.
Thank you so much for that, Dr. D'Amico. Does anyone else have any comments or edits on our meeting minutes from the July meeting? Hearing none, I would like to ask if anyone wants to motion to approve these minutes.
This is Bruce Davidson. I will move to approve the minutes.
Do we have a second?
This is Dr. Yoon. I can second the motion.
Great, thank you. And I will go ahead and take a roll call vote for this. And this is going to be a motion to approve the July 14th, 2022 meeting minutes with amendments. Dr.
Just- I'm so sorry.
Yes.
Sorry to interrupt. This is Michael. We'll need to take public comment. We do have a member of the public present.
Sorry, go ahead.
Yeah, that was actually what I was going to say as well. So moderator.
Thank you very much. So yes, we do have a member of the public. So we opened up the Q&A feature for public comment on the minutes. If anyone would like to make a comment on the corrections or edits to the minutes, you may do so by either raising your hand by clicking on the hand icon or clicking on the question mark icon at the bottom row of your computer, typing the word comment into that text box and letting me, and we will call on people in the order their comment was received. And I do not see any requests for public comment. Shall I close that feature?
Thank you so much.
Thank you.
Apologize for that confusion. I think at this point we can take a roll call vote on that motion to approve the minutes.
Great, thank you. So this is, again, a motion to approve the July 14th, 2022 meeting minutes with amendments. Dr. Dara Thompson,
Aye.
Dr. Greta D'Amico,
Aye.
Dr. Vera Singleton,
Aye.
thank you. Dr. Bruce Davidson,
Aye.
great, and Dr. Mina Yoon.
Aye.
All right, and that moves with 5 ayes.
Thank you so much. Is Dr. Osborne still not with us?
She has joined us.
Wonderful. So we're going to briefly skip agenda item 4 and move on to agenda item 5, which is discussion, review, and possible adoption of the committee's intravenous therapy and advanced injection therapy regulation proposed text. We had reviewed this quite some time ago and then had been focusing on sunset, but we had several specific edits which are now incorporated in the text, which you all should have received via email to review. And at this point, we are opening discussion if there are any further edits or if we can move forward with this text as it is now written. So does anyone have any comments on this?
And
This is
that's it.
Oh, sorry.
Go
This
ahead.
is Dr. D'Amico. I wanted to ask a question about on the second page, training requirements, 4237.2, section B. It says that recertification is required every 5 years. And I just wondered if that was on purpose, because I thought we were trying to change things to be every 6 years according to our renewal cycle.
You are correct. That was my oversight. I am so sorry. It should be 6 years there.
Yes, we did actually make that edit. I think maybe it just somehow didn't make it into the final document.
Okay, great. And I just want to confirm my understanding that the advanced therapies that are covered by this provision are the ones listed: IV chelating agents, PRP, microneedling specific with a microneedling pen, ozone and ozone oxygen therapy. Is that correct?
Yes, that is correct.
Thank you.
And this is the moderator. We are displaying the text. Individuals may scroll up and down on the given page at their will. And if you need us to go to a specific page, please let us know. And our presenter, Dr. Virginia Osborne, is in the attendees list, and we have sent her a request to unmute herself in case she has input that you would like from her.
This is Michael Kanoch, your legal counsel. She will have to participate in the public comment portion. So if we're going to open for public comment, we can do that now.
Thank you. I await the board chair's direction.
I see Dr.
Hi,
Yoon's hand.
Dr. Yoon, at this point, I'm going to take comments from the committee members, and then we will open the public comment so that Dr. Osborne can address any of those questions if needed. So, Dr. Yoon.
As I recall from our last meeting, one of the issues that we had with the text was that the microneedling and PRP falls on another category separate to what we were saying the advanced IV therapies required. And I'm not quite sure if I understand that in the text the way that it's written out here. It seems like it's still requiring all of these necessary um, training requirements for it. So, like, as I'm reading it, for microneedling, you still have to get a certificate for IV therapy. Is that correct?
That is correct as it's currently written.
Okay, and are we not changing that, or is that something that we're talking about right now? Is that
It was my understanding from the last meeting that that was something that was not going to be changed, but we can discuss it at this point. That is the
okay?
whole.
Yeah, because I don't see why anybody who's just doing microneedling or even PRP would even need the IV therapy training, nor maybe even the CPR or the ACLS. Um, and that's just my opinion.
What forms of PRP are you referring to other than the microneedling in that context? Are you thinking of like joint injections or?
Yeah, I mean, I feel like for the PRP for microneedling, as well as just straight up PRP injection sub-Q, and I guess maybe joint would be separate. Um, but I still don't see how the IV training pertains to it.
I think that, and this is Dr. Thompson, and I'll just comment in my place as one of the members of the injection committee, and then we can also get Dr. Osborne's input on this. But one of the things that's so important in the basic IV therapy training is, you know, a lot of the safety and sanitation training that happens there. And I would say that although I believe that microneedling and PRP is very safe, that the major issue with that would be not correctly handling the blood products, not correctly, um, you know, having good sanitation and such in place. And that's, from my perspective, why I think the basic training is appropriate in that setting. So we can discuss that more. I would say that this basic training is available at all of the, in addition to the outside training that's offered for people who didn't receive it in their naturopathic education, is currently offered at all of the schools as well. I mean, this is the very basic training. We could, I think it would be very reasonable to put microneedling under just the basic IV therapy and not consider it, you know, an advanced injection therapy if we were going to differentiate that at all. But it's difficult to figure out where to put it in here.
I agree. Yeah, I feel like it is in a whole separate category because as an acupuncturist, I also know there's continuing education on microneedling and PRP that does not require IV therapy training or CPR or ACLS. So I'm just, yeah, just giving you a little bit of context that I feel like it is a separate category in itself.
So you think we should have just a separate section here for PRP microneedling that isn't part of the IV and advanced injection therapy at all?
I think so. I mean, I think, of course, I would like people to be properly trained and for the, of course, the safety for California citizens. But I also feel like the IV section is not where I would expect to have seen this type of therapy.
This is Dr. Singleton. I agree with Dr. Yoon, and just having gone through PRP training recently, a lot of the elements that are within the IV course requirement, it's overkill. It's too much, and I think it's not in congruence with PRP or microneedling. So if it's possible to pull that out and have it separately presented, I think that would be a better scenario. And secondly, they do have safety that's covered in PRP. The training that I attended was sort of administered by MDs, nurse practitioners, and their level and coverage of, you know, safety and handling of biologic materials, I think, was sufficient. I think it's not in congruence with IV. It's very different.
Yeah, I absolutely hear that. This is Dr. Thompson again. I just want to also point out, and I'm interested to hear what Dr. Osborne says about this, is that if we set it up as a separate training and separate requirements, that people who are IV therapy trained will then have to do different and separate training for the PRP microneedling as well.
This is Dr. D'Amico. Perhaps we could look at the original reason why it was felt we need additional regulations for this therapy, given that my understanding of our current laws and regulation is that we can perform anything within our scope as long as we're adequately trained. And it's not necessarily delineated the exact number of hours as long as it's from a qualified provider. So, to have a separate regulation sort of implies that this is so dangerous, or there have been so many problems with it, that we need to get in there and be even more specific about what people have over the qualifications and requirements to become a qualified provider of this knowledge, and the requirements that they have in getting educated, and the responsibility that is given to a licensed practitioner to only practice those things for which they are adequately trained and qualified. I wanted to ask a question as well. If somebody could please tell me, and I'm sorry that I don't know this, but what does this mean, microneedling, and what is a microneedling pen, please?
This is Dr. Singleton. I can tell you about that. So microneedling is using an electronic pen or stylus, and on the end of that pen is essentially, if you can visualize, anywhere from 12 to 36 very small, maybe 3 to 5 millimeter needles. And so within the head of the stylus are these individual needles. And essentially the idea is to create um, collagen stimulation within the epidermis of the skin. And usually the application or the treatment is about 20 to 30 minutes. But ideally, with most of the microneedling pens, so it is an electric tool, and the idea is to, like I said, to create like new collagen stimulation. But for most people, the idea is to not sort of extract blood. There's mainly an erythematous effect. And then after the treatment is completed, most of the pen, etc., is considered as it's like a syringe, and then that's discarded essentially. And most times it's used in aesthetics, medicine. PRP, on the other hand, is a little bit, it is more invasive, but microneedling is pretty much done by estheticians in office, who just have a basic esthetician's office. And of course, they're monitored by their supervising clinicians.
Yeah, and thank you for that. I really appreciate that. And to me, we already have applications of electricity, even in much stronger forms already under our law, as well as, of course, all kinds of ways of using needles on the skin. So I'm not sure why this needs additional regulation.
This is Dr. Thompson, and I agree, this is a subcutaneous injection, and I believe that the initial inclusion was based on multiple questions and things that had been brought up to the committee prior to the implementation of these regulations. So at the time that we were putting these in place, we were getting a lot of questions about this from our licensees, and there had been a couple of incidents not with naturopathic doctors, but just with patients in general having bad reactions. And so that is what had brought this into being added, and we can certainly take it out if we feel that's inappropriate. Rebecca, do you recall, it's been quite a while since we put these together, do you recall what the original questions or incidents were regarding PRP? Because I know when we originally put this together, there had been some concern around it.
So yes, and this kind of goes back to the 2016 incident, unfortunately, with the IV therapy. However, we were contacted by the San Diego District Attorney's Office, I'm sorry, Attorney General's Office, and had a lengthy discussion. They were concerned because we don't have any regulations at all concerning our IV therapy or advanced injection regulations. And because of the event that occurred, they were very adamant that we really needed to come up and develop some regulations that would make it a lot safer for our licensees, and so that there were no gray areas, and that it was very, concise, and that they knew what they were supposed to do. So that is why we decided to do this. There was, at that time, back in 2016-17, if you remember right, there was a lot of back and forth with ozone therapy, and there was just a lot of pushback on us for that kind of stuff. So at the time, PRP injections into the joints and stuff, they were all big, like big flags on everybody's kind of agenda. So we wanted to, at that point, bring all of these things and take a good look at it. And at that point, the committee decided it was best interest for the consumers, and for our licensees to have clear direction on what they needed to do in terms of training and certification and that type of thing for both the IV therapy and for advanced injections.
So this is Dr. D'Amico. I'd like to propose, first of all, I just want to clarify, microneedling, as it was just explained, is not even subcutaneous. It's supracutaneous, and it's not an injection. It's a puncture of the supracutaneous, you might say. So there's nothing being injected, and there's nothing going under the skin, the outer layer of the skin.
I just want to clarify that that's not actually accurate. When microneedling is done, there's always some sort of a substance placed on the skin with the intention of driving that substance below the layer of the skin. It can be done with a variety of different things. The most common ones are PRP or a hyaluronic acid combination. So there is actually although there is a mechanical process happening, I have not ever seen it done where there's not also a substance which is meant to be introduced under the layer of the skin.
Okay, great. Thanks for clarifying that. I'd still like us to consider after we hear from public comment, consider just removing the microneedling provision, with the thought that we can always do more regulations in the future should there be issues, injury, or complaints or problems. I think that was a little bit overkill, and then perhaps we can discuss the PRP a little bit more, or consider that after we have more public comment.
Dr. Yin?
Yes, can I ask the moderator to go to page 3 where the microneedling and the PRP is? But I would like to say I also definitely agree with Dr. D'Amico, sorry about that, about getting rid of the microneedling, but I also feel the PRP needs to be removed as well. The PRP, so basically from my knowledge, is that it is normal phlebotomy that happens, which is within our license, and then they spin it and then they separate out the platelet-rich plasma, and that's what they apply topically. And we are able to do topical solutions that are natural. So I don't see how that would be an issue. I think if it is PRP as an injection, I feel like, yes, that needs to be somewhere, but probably not in the IV, the intravenous category either, because this is also, again, a phlebotomy technique and not necessarily to remove the PRP, and then the injection is somewhere else. So that could be an advanced injection therapy section.
This is Dr. D'Amico. That being said, as I know it, unless perhaps other board members have other experiences with PRP, but it's usually used in the context of a prolotherapy, an intra-articular injection in or around a ligament and so forth, which is my understanding we're already licensed to do and can do with other substances that isn't just the platelet-rich plasma. including homeopathic injections, sugar, salt, water, and so forth.
Can I just add some information just for a little bit of context here? So when we have received complaints against licensees that had to do with injections and going and trying to get their training certificates to make sure that they've met these trainings. We have seen in the past, and I know that this is the same with other practitioners, is that they have a training for one type of PRP, but then they're doing it somewhere else. And it's a totally, from my understanding, and please let me know if I'm incorrect, but from my understanding, if you're doing PRP on the scalp, it's going to be different than if you're doing PRP injecting into a, a joint in the knee or something like that. So at the time, and I know that the subcommittee, when they were discussing this, and we can actually go ahead and go over to Dr. Osborne and get her take on this as well. But when we were discussing this, that was some of the issue, is that people were not getting the proper training for the type of procedures that they were doing. So that is one of the things that the subcommittee took a look at, and that is why they said that they needed to have the type of area that they're going to be practicing, or not practicing, but treating on, that they need to take that type of training specific to that. So that was a little bit of context on to why they're adding some of these, and that they have to be very specific to the areas. But I don't know if Dr. Thompson wants to go ahead and bring Dr. Osborne on to give her take on this.
I think at this point it does make sense to open for public comment, and then we can always come back and discuss more as a committee.
Certainly, this is the moderator, and we've opened up the Q&A for public comment. And Dr. Osborne is also welcome to raise her hand by clicking on the hand icon. And that way we can request that she unmute herself, and we'll be able to have a more in-depth discussion with her. Thank you, Dr. Osborne. I'm sending you a request to unmute yourself.
All right.
And thank you, you're unmuted.
All right. Hello, everyone. This is Dr. Virginia Osborne. And, I appreciate all the comments that have been made. I'm familiar with PRP and, microneedling. I think that I agree that there are two phases of that, and that there is the really basic that we all have from our education. But there is the advanced piece, and I do know that. And when you add anything to that PRP, when you're injecting it back in, you actually have that issue of contamination that might occur in transferring it. Also, you have to remember that when all RNs and medical doctors are CPR trained, and most medical doctors are ACLS trained, that's advanced cardiac life support. So with that being said, I've seen a lot of stuff out here, I'll be honest with you. And, it's one of those things, if we can just have somewhere that this PRP is, when in advance, falls under the IV category, that you are at least CPR trained and you know what to do in an emergency. Because trust me, the last thing you expect is an emergency in your office, and by gosh, they happen. So that is my perspective on it, and I agree. Microneedling without any additives on it is totally benign, and has the practitioner's training that is supporting them, and that's what that's all about. All those trainings are to say, yes, I've had this training when anything comes to a legal concern. So that pretty much sums it up of what I've heard today and what I think about it, and I support all of you.
This is Dr. D'Amico. Can I make a comment?
Do we have to close the public comment for the members to make comments, or can we leave it open and have an open discussion?
This is Michael. Yes, I think you can leave it open. You'd need to do that with other members of the public as well, but that's fine.
And this is the moderator. If there are any other members of the public who wish to comment on this issue, you are welcome to raise your hand and I'll send you a request to unmute yourself. And I don't see any others wishing to participate in this conversation.
Thank you. I'm sorry, was that Dr. D'Amico that had a comment?
Yes, thank you. I think Dr. Osborne does bring up a good point in that when PRP is applied, there is usually an admixture, meaning that other drugs and substances are usually added and mixed in with the PRP that's extracted from the blood. I also think that the point that she made that most MDs are going to have ACLS training and all nurses are going to have CRP training. I'm sorry, not CRP. You know what I'm talking. Say it.
CPR.
CPR. Thank you. And, you know, if that's not already a requirement to be a doctor, we should just have it not in this section, but we should have it for everybody already. You know, we can decide if everybody needs ACLS, but everyone should have CPR, shouldn't they?
This is
I mean,
Dr.
I think that definitely, so sorry. Go ahead, Dr. Yoon.
Sorry, this is Dr. Yoon. Yes, I agree with that. Because I do know that actually the last time I took CPR, there were changes that were made on the number of compressions. So I feel like, yes, that would be a great thing to have for sure. But I was actually questioning it more so for a procedure like microneedling for aesthetics, having to have that where, you know, I would say as an acupuncturist, you know, that's not required to have CPR, and I'm putting needles far deeper than I would be for microneedling.
This is Dr. Thompson. I think that there's definitely room to discuss removing the microneedling from this section. I would say in regards to the CPR, when you're doing any sort of an injection or an invasive therapy, I think that we need to be aware that people can have vasovagal reactions. And it seems like having basic CPR training in order to do that is important. But I agree with both of you, Dr. Miko and Dr. Yoon, that may be so clearly applicable to almost anything we do in our offices that it could be part of our general requirements, and that's something for us to discuss, but unfortunately not on our agenda today. So I think that's something we would have to look at on a future agenda. So for right now, I think the major things that we're trying to decide is whether we keep microneedling in this section and whether we keep PRP in this section. And I mean, I have my own opinions on that, but I'm not sure how we come to a decision as a committee as to how to figure that out. I'm personally of the opinion that it does make sense to remove the microneedling, but I would strongly advise to leave the PRP, and that's for two reasons. The first is because I think there is higher risk with different PRP injections, and we talked about other things being added to it, et cetera. And the second is just because this is something that was requested of us largely by other bodies. I don't think it puts an undue strain on our licensees, and I think we have to look at the larger landscape of, you know, maintaining our credibility and the safety of the public.
And I'd like to add, the training that licensees take for these recertifications can be used towards their CE requirements. So it's not like we're putting them out and making them take extra stuff. This is stuff that they're going to take that is going to satisfy their CE requirements for renewal anyway. So I just wanted to put that out there.
This is Dr. D'Amico. Do other practitioners who do PRP need to recertify every 5 years, like nurse practitioners and MDs? I don't think they have to certify at all.
I don't actually know the answer to that.
My impression, having received this from a few doctors myself, is that they, they do the training, they do the procedure. There's no requirement for the training. There's no requirement for recertification at all. And I just to bring in a principle here, we definitely want public safety, whatever that may mean. I will say that, one district attorney's opinion from many years ago in reaction to an unfortunate event does not necessarily represent the bigger picture, although it could. And also, sometimes it seems to me that we put naturopathic doctors under far more rigorous requirements than their colleagues as MDs or DOs with similar or even more training behind us, that we have much more stringent things. And I'm just, as a principal, wanting to be careful that we don't, that we regulate when needed and necessary for the safety of the public, but to really avoid it when it's already covered under our training. And I think there's a good argument here to keep the PRP, but it might be worth having a small discussion. Is it worth recertifying every 5 years and so forth on that? And of course, I agree. I think everyone agrees, and we can find out if not, that the microneedling can be removed. But just wanted to kind of bring those thoughts in so that we're looking at these things from the level of principle and not just for each individual thing as it is, because those principles will help guide us in all the work that we do on the committee.
This is Dr. Virginia Osborne. I'd like to clarify something for all of you. We're talking about certification here. Well, all MDs and DOs that are board certified, they have to go back and sit for their boards. I don't know if that's 5 or 10 years, but it depends on their specialty. And under that falls all those certifications for them. We don't have to do that.
Thank you.
I believe that is 10 years for the MDs in California, as I know several of them. So
This is Dr. Singleton. Can I add a quick comment about PRP? So when I think about, again, just being recently trained and the scope and diversity and application of PRP, when I think about the content of what was covered, and if someone were going to use, and if I think about the origination of the use of PRP, it was mainly for orthopedic application. And then it's just been off-label use for aesthetics primarily and hair growth. So in that realm, I think about the use of ultrasound, guided ultrasound, right? So there's other tools that are used to improve accuracy of PRP use. The second thing is around sterilization technique, because you are injecting into a joint, and those sort of requirements I think are very different than IV. I think if I were someone who just wanted to do PRP for the true nature of for orthopedics or pain management, having to do chelation education would be a waste of my time and money and effort, because it's not something that I would ever apply in practice. So I think I understand the original intent of having it here, because it is it is concerning inject as an injection tool, but I think it's not relevant to IV. If we're gonna create guidance around it, I think it should be pulled out and separated. I think that it's not relevant in terms of the true nature of PRP and the way that IV therapy is being currently used.
I just want to clarify something about what you just said, Dr. Singleton, which is we are absolutely not requiring people to do chelation training for PRP in this language. The recertification for each of these are separate. So the recertification for IV therapy is separate from the recertification for chelation therapy, for example. So those could all be combined into a single class for ease of our licensees, but that's not the way it's written, just to be clear.
Understood,
Yeah.
yeah.
That being said, I mean, I think that, you know, the issue that we're having here is that the PRP is not used intravenously, although this package is for intravenous and injection therapies, just to be clear.
If given what you just said, this is Dr. D'Amico, that the certifications are separate, so you don't have to do IV class in order to do a PRP. Looking at the requirements in the office, most of those are kind of basic life support requirements. Would you need to require that a person who's only doing microneedling, or let's say we take that one off, only doing PRP and not IV therapy, would need additional IV fluids, tubing, and needles in their office? Which could be relevant if they do ACLS, but you know, if they're not IV certified, then they wouldn't necessarily have the ability to use those items.
If there was a safety issue, you mean?
I believe in ACLS, I don't even know if you start an IV in ACLS necessarily, but if a person's not really certified to do IV therapy, but they are for PRP, would they be required to have IV bags in their office maintained as part of this provision? This is on the requirements on the back page.
It's an excellent question, and I think one for us to discuss. I know that I would not want to be in a situation where I was injecting someone where I couldn't start a saline drip on them if they went completely vasovagal on me, but I don't know how significant of a risk that is. I'd be interested in Dr. Osborne's opinion.
This is Dr. Osborne. And what I would say about that is, in the case of vasovagal, it's really understanding how to manage that. And it doesn't really always require an IV bag tubing for that. So I think that this could be we can have a discussion on that about how it can be a separate category, but also inclusive for those who do IV therapy, you know, it could be covered under it. So, you know, basically vasovagal, I mean, any one of us probably know people who've just, you know, gone into vasovagal and passed out. But that, you know, that's really what we're looking at, is that, you know, one, that they have a training in PRP, and two, that, you know, we will have a further conversation, but I think it could be separated.
This is Dr. D'Amico. So I might suggest that after number 7, additional IV fluids, tubing, and needles, we just put a parenthesis saying for the IV certification, or for the IV, you know, for those who are doing trained in IV, or, you know, just clarify that it's a provision for those people.
Or put an exception in the PRP section.
Well, if you do it with the IV people, then it covers anything that you know, for example, someone may do ozone therapy who does only rectal insufflation. They do no injections with it. And they wouldn't necessarily need to have IV bags either. So if we have, you know, after IV bags for those who are, you know, doing IV therapy, then it kind of covers anything we might add in the future, rather than having to do an exception for every single one.
Yeah, that makes a lot of sense.
Agreed.
So I don't know if this is a point where we'd make a motion, but just to solidify our thinking and just to see if everybody agrees with this, I'd like to suggest or propose that we remove the microneedling provision, that we leave in the PRP provision, and then we add a little paragraph, parentheses on 4237.3, section D, item 7, that says for those performing IV therapy in their office or certified in IV therapy. Does anyone not agree with that, given our discussion to this point?
This is Dr. Yoon. I'm unclear. Does that mean that the way that this is written, still to do PRP, let's say the most invasive would be like in the joint, you would still have to do the IV therapy, the basic IV therapy certification?
No, because it was explained that each of these is a separate item. So
Okay.
you would not have to do IV training to do PRP, but you would need to have the 6 hour of instruction, which includes 4 hours of lectures and 2 hours of hands-on training. And you would need to recertify every 5 years. And you would need to comply with the provisions on the back page of what you need to have on hand in your office.
And can you go back and say what section that was that you were talking about afterwards of leaving the PRP in, but then specifying this other section to
Yeah,
specify that's only IV therapy? Which section is it?
that's on page 4, and it's section 4237.3, paragraph
Okay.
D. So this is where your
Okay.
mobile emergency box or cabinet, and then you have
Okay.
all of this emergency equipment, and that you just put that those little parentheses after number 7.
Perfect. I agree with that. I think that's a great resolution. Thank you.
Do we have any other questions for Dr. Osborne? I think she is going to need to leave soon. She said she had an 11 o'clock limit. So, thank you so much.
All right.
We really appreciate you being here, Dr. Osborne. And so at this point, are we, with these edits, Rebecca, are we able to approve this with edits? Would we need to come back and have the final language approved at a future meeting? What would we need to do to make those edits?
Sure, and we can definitely lean into Michael on this one, but I believe if the only thing that we're, excuse me, if the only thing that we are making an amend to is removing, let me go back to my notes, is removing the microneedling provision from 4237.2. I'm looking for that right now. 4. Is that correct, Dr. D'Amico?
Yes.
Okay. And we are adding, now, I'm sorry, now how did you want to add the notation for the number 7 for PRP?
For those certified, for those having the IV certification,
Mm-hmm.
because that would cover not only people that are in this specialized group, which is chelation, right? But also people that are just doing anything else. Because this section is saying that you need special training if you do chelation. This is the number 1.
Correct.
But those who have IV certification, who are not doing that, but other things, they should still have those bags too. So we would just say for those who have the IV certification.
When you're done with that, this is Dr. Thompson. I have a comment/question here.
Okay, go ahead.
So the very first line here. So when I had said the chelation recertification is separate from the PRP recertification, that is true. However, the very first line of this text as written says, in order to perform IV and or advanced injection therapies, a naturopathic doctor must pass a qualifying course on IV therapy from an approved provider. So the way this is currently written with that statement, which we can edit, you would be required to do the basic IV therapy training prior to doing the remaining 3 listed advanced injection therapies, which are ozone therapy, chelation therapy, and PRP. So what I'm hearing from a lot of the members is that we would like to change that such that if you were doing IV ozone therapy, if you were doing IV chelation, of course, you need to have the basic IV therapy training first prior to doing those advanced certifications and trainings. But if you are doing PRP injections, which do not involve putting anything back into the veins, that we would not want them to have to pass a qualifying IV therapy approved course prior to that. Is that correct?
That's correct. This is Dr. Singleton.
Yes, that's correct. That's 4237.2A, correct? That statement needs to be either changed or we pull the PRP and put it in another section.
This is
Right.
Dr.
So
Dr.
I think, oh, sorry, go ahead.
Sorry, just another note. In the ozone oxygen therapy, 5C says direct injection of gas into the vascular system is prohibited, but D says they must be trained in each route of administration used with ozone therapy, including intravenous, which is the vascular system. So we have a contradiction there.
Yeah, I just want to clarify what that is meant by that, which is that there are 2 routes that have been used for ozone vascularly. The first is direct injection of ozone gas into the vascular system, which carries a huge risk of air embolism and death, which we are prohibiting. And the other is to withdraw blood from the body, treat it with ozone gas, and then re-administer the blood, but not the gas, just the treated blood to the body. And that is what is being allowed. So if we need to rewrite that so that's clear, we can. But that is why that is specifically stated in that way, because ozone treated products are injected back into the body safely. It's just the direct administration of ozone gas into the vascular system that we're prohibiting.
So we might want to, I know we want to get back to what you were doing, but on D, we may want to say naturopathic doctors must be trained in each route of administration of products treated with ozone or something like that.
Ozone and products treated with, probably ozone and products treated with ozone. I think if we just put an and there, but still have the provision of not direct injection of gas into the vascular system being prohibited, I think that takes care of that.
Okay. Did you get that, Rebecca?
Yes, I believe so.
Because I think that we can do this today and I think we can finish it. So as we go through each section, Rebecca can read it back to us to make sure that we approve of everything that when we finally take a vote, if you guys like that idea.
That sounds
This is Michael, Madam Chair. I thought I would just jump in and answer the previous question. You certainly can take action on this today. I will generally defer to your Regulations Council, Ms. Tomaselli, in terms of the substantive changes. And I think there's probably some proposed motion language that you use in terms of the adoption. What I would do, though, is to make the specific changes, I would use that motion language, and then I would add on to the end, basically with the following changes. And you want to list them out specifically so there's a clear record of the regulation language that's being adopted by the committee. It's probably a good idea to do that in writing, but depending on the complexity of the changes, you can certainly do it um, um, by just speaking the motion as well.
Thank you so much. I have proposed language for 4237.1A. Can I state that, Rebecca? Are you ready?
Yes, I'm gonna actually go through all these changes as you guys are speaking. So just give me 1 second because I need to get my red pen. Okay, so you're at 4237.1.
It's like the very first line of the.
Okay,
So instead of saying, in order to perform intravenous therapy and or advanced injection therapies, can we say and or advanced injection therapies that involve IV administration?
okay,
Because I think that will make it so that we don't have to change any of the other language significantly.
okay. So I have the change to 4237.1A, and we'll add after the first line there, injection therapies that involve IV administration. Okay, I also have on page 2 of the same section, 4237.2, to change that 5 years to a 6 year. On page 3, we will remove section 4 that has to do with the microneedling. And then I think my only question on this is for 4237.3 on page 4. And this has to do with the number 7. So how are you wanting to remove that or to notate that? I know that you said for those having IV certification, but if we're actually adding that first part, do we need to do that?
I think we still do, because I think there's separate requirements. One's on training and one's on what you have to have in the office.
Okay.
Yes, and it also says at the beginning for advanced injection therapies, which we're delineating here, but some of them do not require IV training, so they wouldn't have the bags.
Okay. So,
We could edit the title to advanced injection therapies, like we did at the very beginning, which involve IV administration or something like that.
sure. I mean, we could do 2 separate sections, 4237.3 and a 4237.4 if there's not already, oh no, there's already one. But what we can do is maybe do the 4237.3 and then a 4237 point, I don't know, 3, whatever. And what we could do is just do one for the IV therapies and one for the advanced injection therapy, maybe for office requirements. It may be a little bit clearer, as opposed to just having them all in one section.
I think the question here is which of these do we think, like, is it only the additional IV fluids, tubing, and needles that we think is not appropriate for the advanced therapies, or do we think none of these are appropriate if you're doing injection therapies that are not intravenous?
This is Dr. D'Amico. I think having an emergency defibrillator on hand is maybe a bit much if you know there's one nearby, and a backboard. I think most of this stuff people have in their office if it's.
Unfortunately, Dr. D'Amico, that's not the case, and that's why we were.
I mean, we can say most people have a stethoscope, a thermometer, a blood pressure cuff. I hope. That would, I don't know if you're not doing IV PRP, would you need oxygen? And I, you know, some of the medication is only injectable. So if they don't have ICV certification, you wouldn't be injecting them anywhere else with calcium gluconate or calcium chloride or dextrose or diphenhydramine.
So it does sound from that we do need two separate sections.
Okay. So I did want to interject on this. So when we first came up with this, we were going to ask for the ability to have the injectable diphenhydramine. Unfortunately, we were unable to get that during our sunset. So at this point, unless an ND has a supervising protocol from a physician, they would not be able to use the injectable. So, and I think that that is something that the CNDA, maybe that we need to have some conversations, but this is something that, for emergency use, I know that we had it during the waiver for the COVID vaccine, but once that waiver goes away, you guys will not have that independent ability to administer that diphenhydramine as an injectable. So I just wanted to put that in there because we will have to remove that from this for now. And that's going to be E.
Okay. This is Dr. D'Amico. I like Dr. Thompson's suggestion that we just title this 4237.3 intravenous and advanced injection therapy therapies involving IV administration office requirements. And that way we're just talking about when you're entering a vein, an artery, you're doing anything with the vasculature, we're just going to have all this safety stuff in place. If you all like that.
Minus, sadly, the injectable diphenhydramine, because we can't require our licensees to do something they're not legally allowed to do.
Right.
Right.
Does anybody have any problem with that? We just retitle that paragraph, then it kind of takes care of it.
And is consistent with the previous language that we changed.
Yeah. And then there was one other change Rebecca forgot to mention, which was right above it in number 5, oxygen ozone. Dr. Thompson had suggested adding each route of administration used with ozone therapy or ozone treated products or something like that.
And I'm sorry, where are we at?
Number 5, ozone therapy 4237.2.5.
Second.
This is Bruce Davidson. I'd like to jump in here, may I?
Yes, Bruce.
On that item, I was wondering in terms of wording, whether the objective could be accomplished if the wording were something along the lines of naturopathic doctors must be trained in each in each allowed route of administration, because in A and B, the word is allowed and in C it's prohibited. So if it were must be trained in each allowed route of administration, then perhaps that would cover it.
I think that's a great edit, Bruce, but I also want to make sure, and I think Dr. D'Amico pointed this out in a way that's really helpful. I want to make sure that it isn't written such that ozone treated blood products are prohibited. So I think making that edit and specifically spelling out instead of intravenous, yeah, how do we want to say this?
What you might say is change C.
Yeah, because, well, no. So A actually already says this, because A already says the treatment of blood, PRP, and saline with ozone gas, which is then injected into the vascular system or tissues, is allowed.
Mm-hmm.
Yeah,
And
that's
then
what I was noticing too.
C says, yeah, so you're right, Bruce. That totally takes care of it. And then C says the direct injection of ozone gas into the vascular system is prohibited. So it's actually already spelled out there. So I think you're right. I think that edit would do it. Sorry.
So then, Bruce, just to make sure that I'm following you. So in D, you'll put the naturopathic doctors must be trained in each allowable,
Allowed, because that's
allowed.
the exact wording that's used above.
Yeah, that reflects the wording in A and B.
Perfect.
And then do we still need the list of subcutaneous, intradermal, et cetera?
Mm. It just clarifies it more, but that's definitely up to you guys
That's
if you
fine.
want to leave it. Okay.
And then do we really need B at all, since right above it, it says it's allowed in the soft tissues? Or is that because it's direct injection of ozone gas?
It's direct injection of ozone gas, which is different than ozone treated fluids.
So why don't we put direct there to mimic the one in C?
Sure.
Just to be clear that we're trying to signify not mixed.
So the direct injection of ozone gas into soft tissue is allowed?
Yeah.
Okay. Okay. And then so on page 4, for 4237.3, we can go ahead and leave 7 then, which is the additional IV fluids, tubing and needles. We don't have to remove that.
Correct. If we change the title, we don't have to edit anything on here except the injectable diphenhydramine.
Perfect. Okay, let me go ahead and read back through these edits really quick to make sure that I've gotten them all. So on page 1, 4237.1A, I have in order to perform IV and or advanced injection therapies that involve IV administration. On page 2, we are taking and changing the 5 years to a 6 year. On page 3, we are removing.
Rebecca,
Uh-huh, go ahead.
this is Dr. Yoon. Sorry, I'm toggling between different pages, but 4237.2, the second page, A.
Yes.
I think we have to change this because this is pretty much saying that you need to take the IV course for the PRP. Because this is in order to perform advanced injection therapies outlined in subsection B. And under B, you have the chelation therapy, the PRP, and the ozone therapy. Am I reading that right?
So B is going to be everything in that list. Let me take a look. Hold on. Yes, so B includes 1, 2, 3, no more 4, but 5. So yeah, no, I think that's correct, Dr. Yoon.
This is Dr. D'Amico. It refers back to 4237.1. A says in order to perform IV or advanced injection therapies that involve IV administration, it's a little circular. So maybe our lawyer has a suggestion on how to make it a little more smooth.
Yeah, this is not clear to me because I feel that, again, for the PRP, it's requiring the IV therapy that's stated under 4237.1, the training requirements for the IV therapy.
So we could just put in order to perform advanced injection therapies using the IV route of administration or that involve intravenous.
But did it not do that when you added that involve IV administration in A of 4237.1?
It does. Would it be a little clearer or easier to understand if you don't have to keep referring back to another section? We'd want to make it easy for people after us who don't remember our conversation today.
It is. I'm gonna lean into Michael on this one and refer to him. Normally in code we do refer back to a code section instead of restating it, and that's just to keep things very clear and that there's no chance of putting something in there that's not supposed to be, but I will go ahead and refer to Michael on that.
Hi, this is Michael. So on these matters in generally, as your board counsel, my concern is that you have a clear record of what the changes that you're making in terms of adopting the regulation, if it's not the specific reg uh, that was written in your materials. But in terms of the regulatory language, the motion language, I need to defer to your regulations counsel, Gina Tomaselli, who is also on the call, so she can handle that.
Gina, are you available?
Yeah, I'm available. Um, I am
Well,
going.
yeah, I think the concern here is we know what we want to say, and we want to know if it's already stated in that way or if we need to add something. We don't want to accidentally make a double negative or something like that by adding something where it's not needed.
I need to. I can't give real time advice on what the text should say.
Okay.
That's an internal review process that we have to. There's a separate process for that. So I would, draft it as you wish, and then our team will review it later, but I can't advise on what the language should say right now.
So that would be a next step, or is that what you're saying?
Right.
Okay.
This is Dr. D'Amico. Why don't we just walk through it ourselves, if that's okay? We have section 4237.2, training requirements for advanced injection therapy courses. In order to perform advanced injection therapies outlined in subsection B, so that includes IV chelation, PRP, and ozone. A naturopathic doctor must pass a qualifying course as outlined in section 4237.1. So we go to 4237.1, and that says training requirements for intravenous therapy course. So that's kind of interesting because the title says it's for the IV course. Okay, but it does say in A, in order to perform IVs or advanced injection therapies that involve IV administration, a naturopathic doctor must pass a qualifying course in IV therapy from an approved provider, good for 6 years, and then it says what has to be in that course. So I think we're okay unless somebody sees something that we're missing.
Dr. Thompson, I agree that I think it's clear as written.
It wouldn't hurt to say in 4237.2a, it certainly wouldn't hurt, and they can always take it out if they think it's redundant. In order to perform advanced injection therapies involving IV that involve IV administration, just to mirror the one from before, I would suggest we do that. It makes it extra clear, and if somebody doesn't like it later, they can take it out.
I think that to me, it's a little bit unclear still because then B goes on to say a naturopathic doctor must have additional training for the following advanced therapies listed in this section, which that is very, very clear. But the other one pretty much says like you have to go back, and to me, it still sounds like you need to have the IV training, which you do have to have the IV training for if you're wanting to do the chelation therapy and the ozone. But the question is about the PRP.
Well, when we made the change to say advanced injection therapies that involve IV administration, then we were requiring the IV course for any injection therapy that uses IV administration and not for those that don't.
Correct. And I think it's fine to, as you said, I think it is more clear to just add injection therapies that involve IV therapy there, because that's our intention. And just to be clear, we're not, as Dr. D'Amico pointed out, we're not just talking about PRP. We're also talking about things like rectal insufflation with ozone. You wouldn't need IV therapy training, but you would need ozone training to do that. So the way it's currently written. So I think that's more clear. Does anyone have a problem with us adding that to this section just to clarify? Does anyone think that that's going to be problematic? Okay, then I say let's just add it. Are you clear on what you're adding here, Rebecca? This is 4237.2A. So in order to perform advanced injection therapies involving, what was the exact wording we used above? Involving
That involve
that
IV
involve IV
administration.
administration. Yeah.
that involves IV administration, as outlined in subsection. So we're referring back, and we're using the exact language that was used there.
Yep.
Got it. Clear. Thank you.
Perfect. Okay, so let me go ahead and go through these again just to make sure that we have everything. So starting on page 1, we're adding at the end of the, let me see, 4237.1A, in order to perform IV and or advanced injection therapies, and we're adding that involve IV administration. On page 2 for 4237.2A, in order to perform advanced injection therapies that involve IV administration as outlined. And then we are also amending 5 years to 6 years. On page 3, we are removing section 4. And for section 5B, we are going to add direct. So it's going to read, the direct injection of ozone gas into soft tissues is allowed. For number 5D, as in David, it is going to read, naturopathic doctors must be trained in each allowed route of administration. So we're going to add allowed there. On page 4, we are going to fix the title for 4237.3, should read intravenous and advanced injection therapy involving administration of IV therapy.
That involve IV administration.
Okay, let me change that. Okay. And so we have 4237.3, intravenous and advanced injection therapy that involve IV administration. We go down to section D as in David 7. We are not going to make any changes to that, so that will be left in. We are going down to section DE, which is a diphenhydramine oral, and we are removing an injectable.
Would you all like to make that oral diphenhydramine?
I think that would be better.
That makes sense.
Yep. Okay. So we will put oral and remove the oral and injectable from the end of that sentence. And I think that is all of the edits that you have asked for.
I think we can call for public comment.
And this is the moderator, and we are opening up for public comment on the discussion, and DCA employees are the only ones in the public comment at this time. Is there any DCA employee who would like to make a comment on this motion?
Sounds like there's not.
No, it does not. Shall I close the Q&A public comment feature?
Please do.
Thank you. And I do see raised hands among committee members.
Hi, this is Dr. Yoon. Sorry, one quick comment for the diphenhydramine. Should we take out oral and just leave diphenhydramine? Because if you do have a supervising medical doctor, you may be allowed to do other options, right? So if we just leave it diphenhydramine, and in case our other scope of practice laws change too, we don't have to go back and change this. Just a thought.
I think that's fine, although since these are requirements, it doesn't prohibit you from doing IV if you can. It just says you have to have the oral on hand.
If we just have diphenhydramine, then people can choose whatever they can do. And
Right. Totally.
okay, so let's just do that.
Okay, removing oral and just leaving the diphenhydramine. Thank you.
This is Dr. Thompson, and I would like to move that we approve the IV therapy and advanced injection therapy regulation proposed text with these edits.
Okay, would you like me to read the appropriate motion that our regulations attorney has provided to us?
Please.
Okay, so the motion is to approve the proposed regulatory text for sections 4237.1, 4237.2, 4237.3, and 4237.4, and direct staff to submit the text to the Director of the Department of Consumer Affairs and Business, Consumer Services and Housing Agency for review, and if no adverse comments are received, authorize the registrar to take all steps necessary to initiate the rulemaking process, make any non-substantive changes to the package, and set the matter for a hearing if requested. If no adverse comments are received during the 45-day comment period and no hearing is requested, authorize the registrar to take all steps necessary to complete the rulemaking and adopt the proposed regulations of the sections as noticed. And I believe that the registrar on this case should be the executive officer. Do we have a
So
motion?
do we need to make a new motion after that?
No, I just need somebody to make that motion.
I would make that motion as you just stated.
Thank you. Do I have a second?
This is Dr. Singleton. I second that.
Wonderful. Do we need to take any more public comment?
This is Michael. Yes, you should on the motion.
Thank you. This is the moderator, and we are opening up the Q&A feature of WebEx to facilitate public comment. And again, at this point, there are no members of the public aside from DCA staff members. And as a reminder to our legal counsel, does that mean we're allowed to close public comment again right away?
Yes, thank you.
Thank you so much. So I'll close the Q&A feature. Thank you.
Perfect. And I will go ahead and take the roll call vote for this. Dr. Dara Thompson.
Aye.
Dr. Greta D'Amico.
Aye.
Dr. Vera Singleton.
Aye.
Dr. Bruce Davidson.
Aye.
And Dr. Mina Yoon.
Aye.
Great. And that looks like we have 5 ayes and the motion moves.
This is Dr. D'Amico. Are we handling the, yes, we are. Next agenda item is separate, 5A.
This is Dr. Thompson. At this point, I think that we do need to take a 10-minute break. So it is 11:32. If we could have everyone back here at 11:42 to continue with our agenda. Okay, it is 11:42. Is everyone back? Rebecca, can you take a roll call to make sure everyone's back online?
Absolutely. One moment. Okay, Dr. Dara Thompson,
Present.
Dr. Greta D'Amico,
Present.
Dr. Vera Singleton,
Present.
Dr. Bruce Davidson,
Present.
Dr. Mina Yoon.
Present.
Thank you so much. Everybody is back on and we have quorum.
Wonderful. Thank you all for being so prompt. At this point, we did skip agenda item number 4, so we are going to need to go back and do that now. That is from me, and that is just an update on the FDA process regarding IV therapy and what they're calling hydration clinics. The first thing to say is that unfortunately, I was supposed to be on a panel for this meeting, and we had a huge problem with the login, and I was not able to get on. So that was very disappointing. However, I do have all of the materials that they sent us, and I just want to highlight some of the things that this FDA discussion group is looking at and how it may affect our licensees in the future. They have reached out to us to ask if we'd like to participate in future discussion, and I think they feel bad, so they're going to really make sure we have all our login info at that point. And this is, just starting out with informational things to move forward. So first of all, the main thing that they were talking about are IV hydration clinics, and that does appear to be their main concern. And I think that is, these clinics that have popped up, which people can sort of walk in and order their IV, and they have concerns about consumer safety in that context. So that's not what the majority of naturopathic doctors are doing. They are administering certain medications intravenously, which is different than these hydration clinics. But I do think that that's something for us to pay attention to, the fact that the FDA is concerned about this. And we've already told our licensees you can't have B12 happy hours and things where people can just drop in and not get properly assessed prior to having any injections. So I think we are checking the boxes, and what we just spent over an hour going over with these IV regulations really shows that. And they also appear to have concerns about having these clinics present, so people performing IV therapy with the approval of some sort of supervising practitioner, an ND, NP, physician's assistant, not being on site and just having some other sort of technician performing the IV therapy. So this is something for us to just be aware of as well. This is something that the FDA is paying attention to. They have concerns about in-office compounding, which is at this point the addition of anything to an IV bag that's more than 3 total ingredients, with the original contents of the IV bag being one of those ingredients. So if you're using a saline or sterile water bag, that's only 2 additional ingredients. Anything above that would be considered compounding. And so that's something we need to make sure our licensees are aware of. And then they also just wanted to know if there were any incidents that were happening in facilities that were performing this. Again, they really were focused on these IV hydration clinics. And I think, you know, for our licensees, that's really about how they're advertising, really, because clearly, you know, we are asking our licensees to perform as doctors, do physical exams, do labs, order IVs as appropriate for the medical condition that's present. So this is something that is active and happening, and the major thing that we're going to be doing as a board is going to be making sure that as more of these issues come up, and if there's any new rules or regulations, that our licensees are informed of what those are, that there's no confusion about what they should or shouldn't be doing in an IV setting in a private practice, and just continuing to really keep ourselves abreast of this, to make sure that everyone knows what is appropriate. I think this is something that we can also, it pertains to this specifically. It also pertains to the regulatory language we were just looking at, and it also will pertain to an agenda item further on, which is the LVN supervision by naturopathic doctors. So just something for us to be aware of. Dr. Davidson, do you have a question?
Thanks. I'm sorry. I don't want to interrupt the flow on this agenda item. I had a administrative question about our schedule for the meeting today.
You can ask that, that's fine.
Okay. Are we planning on taking a lunch break?
Yes, at 1 o'clock. If we are
Okay.
not done by then. If we may be done by 1, in which case we'll adjourn, but if we are not done by then, we are taking a lunch break from 1 to 2.
All right, great. Thanks. I'm sorry if I missed that earlier. I just didn't have that on my radar screen. So thanks.
Yeah, I don't think we actually stated it, and I apologize.
All right, thanks. That's it.
That's all I had to say about the FDA update. Are there questions, concerns, comments on that?
This is Dr. Singleton. I'm curious, is the concern nationwide of these hydration clinics, or as I understand, you know, there's one in every state, so it's not necessarily relegated to naturopathic doctors, but is this a concern nationwide, and was there any hint of some impending regulations coming to regulate those?
I think there definitely is a hint. And yes, this is, they are looking at this nationally. This is not California, but an FDA committee that was, or an FDA meeting that happened. Rebecca, do you have something to say?
Yeah, and I just wanted to add that so this is something that is going, you know, a national challenge right now. And what they're seeing a lot of is practitioners that don't have any ability or independent prescriptive rights to perform IV therapies that own these clinics. And then they have people that can perform them, staffing them. So that is another issue where you have somebody that should not be owning an IV therapy practice, owning them. So a lot of times you'll see a chiropractor that owns an IV hydration bar, and they've got, you know, nurses in there that are working it. So these are the types of things that they're seeing, and it's kind of like the new day age of the med spas, where the, you know, physicians were basically renting out their license as a medical director, and nurses were just running these things. So that is one of the issues that are surrounding this, up and over what Dr. Thompson has provided in her report.
Thank you so much. Rebecca, do you have anything else that you wanted to add from that initial meeting that you were on?
No, that was it. Basically, it was just something that is on our radar, that we wanted to make sure that naturopathic doctors are represented in these discussions moving forward, since the practice of IV therapy is something that a lot of our licensees do practice. So we wanted to make sure that we were at that table when these dialogues are going on. So. And I just wanted to state that we do have one more regulation section in agenda item 5 that we do need to kind of look at as well.
Oh, I'm so sorry. That I jumped forward from that.
It's okay.
What was the? I'm sorry. Let's take public comment on this, and then we'll move on to that. Okay.
Perfect.
And this is the moderator, and we're opening up the Q&A for public comment. And again, at this point, there are no members of the public present. Shall I close that Q&A?
Yes, please. Thank you.
Thank you.
Okay, so in agenda item 5, there is also the second portion, and this is going to be the 2-page document for intravenous therapy course provider approval. And can we have our co-moderator put that on the screen for us, please?
My apologies. I had an audio hiccup. What am I putting on the screen?
This is going to be a 2-page intravenous therapy course provider approval that is with the agenda item 5.
Is this what you were
It
requesting?
is. Thank you so much. All right, so this is the second portion of those regulations that we just went over. So the first part was about all of the training, and this is actually the text for the intravenous therapy course provider approval. And so with this, I do have one suggestion on this, and that is to give it a section number. And we have 4237.5 available, which would follow the last section in the prior text that we just approved. And
This is
were
Dr.
there?
D'Amico.
Sure, go ahead.
Number sounds good. I just wanted to ask a question about the 2-year period that they can get approved for. And what's the background or reasoning behind only giving them 2 years?
So schools generally will change their course syllabus every 2 or 3 years. And we'll kind of go over this in a section or two in the agenda coming in a few moments, but that the curriculum is often changed just to kind of bring things up to date. And due to those changes, they would need to update us on the course syllabus and that type of thing, just to make sure that they are continuing to meet those requirements.
Are providers paying a fee for this to
Nope.
the committee?
No, they are not.
Thank you.
So are we simply approving the language as written as part of our as part of the regulation that we just approved? So is that what
Correct.
needs to be in here?
Yes, correct. But this just did not have a section number, so I just had it separated. But yes, this
I
is
see.
what we're doing.
Great.
This is Dr. D'Amico. On that, now that I think about it, should we be charging for this? I mean, it does take some time of the staff to kind of recertify each of these providers, and we certainly do charge when we approve CE credits for other providers.
No, we don't.
We don't.
No, we don't. We don't have the authority
Okay. I think you said we don't have the authority. I think we lost Rebecca.
No, I'm here.
Okay, thank you.
So that is consistent with what we're currently doing.
It is correct, yes.
Okay.
Do we need to add anything about advanced IV course providers, or do you think that if we do the 4237.1, and I believe it was a 4237.2, where it outlined the content in which the chelation therapy has to include as well, should be added in here?
So number 2 on this does cite 4237.1.
Correct. My question is for the advanced, and I know we just went over it, but I don't remember the code section number, but the one that states the advanced therapy, because we're
Yes. So
approving
the
the advanced as well.
Sorry, Dr. Yoon. Yes, so 4237.2 was for the advanced injection therapy courses. 4237.1 talks to the training requirements for the IV therapy.
So do we want to add that in so we have also coverage for the advanced IV course providers?
That's on you guys, but so right now, I mean, in our statute, it does state that you guys have the ability to do regulations for anything in our statute. However, for the IV therapy, under the 3680, I think it's 3640.8, that gives you the direct authority to do regulations for IV therapy courses.
Okay. Thank you.
Mm-hmm.
So then to clarify, for each new course provider, we'll be reviewing each one and approving them as is on our agenda for today.
Correct. Oh, yes. Right now, we would still go over, I mean, at this point, we would still be approving based on our current statutes and regulations. After these become approved and are adopted, then we would go by these regulations, if that makes sense. So today would not be per this text that's in front of you. It would be based off of our current statutes and regulations.
Yes, that makes complete sense.
Okay, perfect.
Are there any other comments or concerns about this text as it is written?
Hi, this is Dr. Singleton. Will in terms of approval of IV courses, if it's already approved, AMA Category 1 approved, will we still need to go through this review?
I'm sorry, if it was proof for what?
The AMA Category 1, which is typically in our CEUs, it's a, as I understand, it's a category that that we already approve. The course, if the courses are covered underneath the AMA Category 1, will we need to go through an additional review for that course if it's pertaining to IV certification?
Well, let me go to
I
our
believe-
regulations real quick.
I believe that we would, because what we are currently doing is we have very specific criteria for which we approve providers in California, and we don't want to open up a box where someone says, oh, I took just some IV therapy course that's AMA approved, and that's going to be my IV certification, because there are a lot of things that we approve for CE that are about specific therapies. And if someone wants to actually be approved as one of our certification providers, we would need to check and make sure that all of these things are in place.
Okay, thank you.
This is Dr. Yoon. On section E, because we are having the recertification for IV to be every 6 years, would it not make sense to have the providers hold on to the records for a period of 6 years as well?
It would seem appropriate, yes.
Yeah, I would say then let's if anybody has any additional comments on that, I think that 6 years would be great for them to hold on to that. Long time, but
Yeah, it is a long time.
Thank you. Are there any other comments, questions, or edits? Hearing none, I would like to open up for public comment.
And this is the moderator. There are still no members of the public available or attending the meeting. Shall I not bother opening it, I suppose?
Aren't we supposed to open it anyway and then just close it quickly? Yeah.
I'm fine with that.
Okay, great.
Thank you. So we've opened up the WebEx Q&A, and there are no members of the public in attendance, and I see no raised hands. So I will close the Q&A. Thank you.
Wonderful. Thank you so much.
You're welcome.
Rebecca, do you have, oh, sorry, go ahead.
No, I was going to ask you if you would like me to read the motion that was given to us by our Regulations Council.
Yes, that's exactly what I was going to say.
Perfect. So really quick, just to review, the two amendments that we are taking to this text language is going to be right at the top. We're going to give this a section number 4237.5, and down on section E at the very end, we are going to change the 4-year to 6-year. All right. And we'd like to get a motion to approve the proposed regulatory text for sections 4237.5. Direct staff to submit the text to the Director of the Department of Consumer Affairs and Business Consumer Services and Housing Agency for review, and if no adverse comments are received, authorize the executive officer to take all steps necessary to initiate the rulemaking process, make any non-substantive changes to the package, and set the matter for a hearing if requested. If no adverse comments are received during the 45-day comment period and no hearing is requested, authorize the executive officer to take all steps necessary to complete the rulemaking and adopt the proposed regulations of section 4237.5 as noticed.
This is Dr.
One of you should go first.
This is Dr. Yoon. I'll move to approve therapy course provider approval.
Perfect. And do I have a second?
This is Dr. D'Amico. I second.
All right. And I will take a roll call vote. Do we have any public comment still?
This is the moderator. I'm opening the public comment feature of WebEx, and we do not have any members of the public who have joined the meeting. So I can close that opportunity as well.
Wonderful. And I will take a roll call vote. Dr. Dara Thompson.
Aye.
Dr. Greta D'Amico.
Aye.
Dr. Vera Singleton.
Aye.
Dr. Bruce Davidson.
Aye.
And Dr. Mina Yoon.
Aye.
Great. And that moves with 5 ayes.
Wonderful. At this point, perfect segue into our agenda item number 6, which is discussion and possible action on the approval of naturopathic college IV therapy courses. So we have applications from CCNM and also the CCNM Boucher campus. Rebecca.
Great, thank you so much. So for agenda item number 6, this is a review, discussion, and possible action on the approval of the IV therapy courses at a few of the Canadian schools. California Business and Professions Code Section 3640.8A2 provides the committee with the authority to approve the IV therapy courses. The first candidate course provider is the Canadian College of Naturopathic Medicine, CCNM Toronto. Has provided the committee with a syllabus and course information for their IV therapy course. Unfortunately, the version that you have in front of you is from their 2019 course. They have made some changes to the course by adding some information, but nothing's been removed from the course. The committee members should review to make sure that it meets the requirements in California Business and Professions Code Section 3640.8. Did anybody have any questions about this?
It was my understanding, Rebecca, that you had spoken to them about this and then they had adjusted their curriculum such that it met our requirements. Is that correct?
That is correct.
This is Dr. D'Amico. If they made an adjustment, can we approve it as adjusted without having seen it?
So what I can do is I can get a current copy of their syllabus and send it over to you guys. So if you want to put this one on the next meeting, you can certainly do that. Unfortunately, they just have not provided me with the new curriculum.
Yeah, I agree. We would need to see that.
Right.
There's no way we can approve it provisionally and then confirm by email or anything, is there?
No, we wouldn't be able to do that.
Okay.
Okay, well then let's go ahead. I'm going to table that one. And we will move on to the second candidate, and that is going to be the Canadian College of Naturopathic Medicine, the Boucher campus. So I'm not sure if many of you know, but a couple of years ago, the Boucher campus merged with CCNM and became the Boucher campus of the Canadian College of Naturopathic Medicine. So they have actually updated and sent the current syllabus, and I gave that to you guys yesterday. So that should have all of the information that you guys need to look at this and make sure that they've met those requirements for you.
This is Dr. D'Amico. Just looking over this, what I'm not seeing here is a lot of the more commonly prescribed things that may be administered by IV that is covered in the IV fundamentals course. And if this is meant to be a qualification for IV certification in California, I think it needs that in there. But someone, please, who knows more, comment.
This is Rebecca. I just wanted to let you guys know that, and I wish that Dr. Osborne was still on here, but so there are some, right, currently we have 2 providers that are schools. One of them are Bastyr and the other one is NUNM. NUNM does not qualify for the full IV therapy requirement. However, they offer enough to give them the basics for IV therapy. And what happens is they would have to go and take the second portion of that through the international IV therapy provider and get that second portion before they would be able to be fully certified for the IV therapies specialty. So if if this looks similar to that of NUNM, where it has the majority of the items, except for that more advanced stuff, then you could approve it as a partial requirement the same way that the NUNM is currently approved for.
So is that something that in that scenario, they still have an extra course they need to take?
Yes, they
But
would have to take, yeah, they would have to take the second course at the IV, whatever it's called, the International IV Therapy, the professionals.
so is that something that we need to approve then, or since that organization is approved by us, they're saying that people qualify to take the second half of their certification, do we need to approve both of them? Do you understand what I'm saying? It's a little bit odd in that scenario.
It is, and that's why I wish Dr. Osborne was still on here. So, Dr. Osborne has and knows all of the different courses that the the international IV therapy courses provide, and she was the one that informed us way back in the day that NUNM did not meet the entire requirement. So when they were first getting approved, we were only able to take a portion of theirs, and then they would have to still get that IV therapy course from the international IV therapy provider. So with that, when we're in the office looking at that, we would have to see both of those certificates. We need to make sure that they took that first IV therapy with the NUNM on their transcripts, and then they would also have to have that certificate from the international IV therapy provider. And if they have both of those, then they meet that requirement. For those that go through Bastyr, they meet that requirement without anything further. So there are two ways to do this, and the provider, the international IV therapy provider, has also been approved by our committee way back in the day. So they are still a provider.
I'd like to suggest that if we're trying to decide in a meeting if somebody qualifies, we at least need the document with the requirements that we can look at the same time, so that we're all not just working on memory about the requirements. But I think the requirements are actually by the number of hours in each subject, based on our last meeting. Doesn't that sound right, Rebecca?
Hang on, I'm going to bring it up and see if I can share it on my screen. Give me a second. But yes, it does need to meet the requirement. Okay, let me see if I can do this. Am I able to share my screen?
Yes, this is the moderator. I've enabled you to share. There should be a share button at the bottom row. And then you can either on the left side share a screen, or on the right half share the document,
Okay.
the application. Perfect. It's very small.
Let me see
That's
this
better.
a little bit better. See if I can make it even bigger. Oops, bigger for you. Okay, so these are the requirements here in 3640.8. And basically, they'd have to qualify. The course shall consist of 25 classroom hours of IV administration through injection of application. So this is all the stuff that it needs to have. And then in the practicum, under section 8A, you have to observe at least 10 IV setups, successful completion of at least 10 IV setups. So there definitely is some information here, and these are the parameters that you would need to make sure that are met in the IV therapy course.
Yeah, so this is Dr. D'Amico. Number 7 has pharmacology, indications, preparation of IV vitamins, minerals, amino acids, glutathione, botanicals and their extracts, homeopathic medicines, etc. None of which is included or delineated on this particular syllabus. So I would suggest that we provide a copy of these requirements to each of those institutions and invite them to resubmit.
Okay. Does everybody have the same feeling on this?
This is Bruce, I do.
Yes, it's Dr. Thompson. I also agree. And I would like us to consider, I understand that I didn't realize that that was what was happening with NUNM, but I still think having a two-part certification like that is complicated for the committee. And it seems like if their previous course is being vetted by an approved course provider, then they could somehow just certify the entire thing and not have you have to do a two-part certification. Do you understand what I'm saying? Do you understand what I'm saying?
I don't think a third-party provider is in a position to say whether or not a school did a good job on the first part because they just weren't there.
That's a good point.
It puts them in a regulatory or a supervisory condition that they're really not in any way.
Right. And we already have the transcript. I mean, that is part of the accreditation of a licensee when they apply. So we do have the transcript. So that's something that we always get. So we can definitely make sure that they've met that first course, and then we let them know, hey, you still need to take this second course over here in order to meet our qualifications. So or requirements. So we do have a process here, but this is kind of what we're going to be looking at if these two colleges don't meet the same requirement as Bastyr, and they're more like the NUNM, then of course they'd have to do a two-part.
I would
It
think.
just makes.
Sorry, go ahead.
This is Dr. Thompson. I say it just makes it difficult for us as a committee because we have the language of the complete requirements. So then how do we decide if these providers are doing their appropriate half? You know what I'm saying? So if we're going to divide it into two parts in that way, we kind of have to have that delineated out for us as to which is which. And I think that we don't have that in front of us. I mean, we could say that it's already in place for NUNM and they're the exception, and that for everyone moving forward, we're just going to say you have to either meet the requirement or not. If we're not going to do that, then I think that we have to have more specific idea of what stage 1 and stage 2 is.
Yeah, and you probably need to get that kind of information from Dr. Osborne since she's the subject matter expert on this. So I'm sorry, but these courses were approved way before my time, so I'm not sure exactly why or how they separated those or what. So I do understand the challenge here because it is challenging. In terms of us as staff, looking at what they've turned in and what they've had in terms of training, it's pretty easy because we see the transcript. We know that they've taken the IV therapy course, both the the lab and the coursework, and then they go on to take the international IV therapy, and then they provide that certificate. And with both of those items, then we will, approve them for the specialty. If they don't have both of those items, then they do not until they've received that secondary certificate from the international IV. With Bastyr, all we need to do is make sure that they've taken the two courses, and I believe, I don't have it in front of me, but it's the IV therapy course plus the, I believe it's the, there's another course that they need to take. So it's both of those courses, and that is what makes theirs a complete thing. So I'm not sure if these other colleges are going to add those secondary courses, but it's right now, this is what we have.
This is Dr. D'Amico. I'd like to suggest that we create a single document that can be sent to existing institutions and used as a reference for any other institutions that may approach us in the future, so that they can see clearly what we're looking for before they actually send in their curriculum. I recall at our last meeting, there were, I believe, 2 institutions that didn't meet the requirements as if they had never looked at our law, and maybe they hadn't. So I think it'd be great just to have a single document. That way you don't have to do anything special. If anyone asks you, you've got it ready to go at the office or possibly even downloadable. And then they can present it in, vis-a-vis our requirements. And it's very clear. Have they met half of them? Have they met 3/4 of them? Have they met 100% of them? It'd be a lot easier and time efficient in the future.
Sure. And I apologize. I had our staff, Raquel, our analyst, just mentioned that it was the medical procedures courses 1 and 2 at Bastyr that need to be taken in combination with that IV therapy class in order to make them a complete requirement.
I love Dr. D'Amico's idea of having a more simple, easy to read checklist. So it sounds like at this point that we're not able to approve either of these courses. And that potentially the IV therapy subcommittee should meet and talk about education requirements and, exactly how we want to lay that out.
Yes, and I would further suggest that we delineate these in one document and actually send them to the existing places where people can be trained as licensable naturopathic doctors in California, to let them know what our requirements are. And then they can decide if they want to change their courses in due time to allow for that, or if they know that there's this additional training available, they may choose to just do the basics or not, or none of it at all, depending on the place where they exist. But at least everybody will be working off the same info, and they'll have this invitation from California.
Sure. Sounds good. I can definitely do that. So just so that everybody is aware, we do have a couple of applicants right now who one went to CCNM, one went to Boucher. They've both taken the IV therapy courses. They've both been doctors for the last 5-6 years, up in British Columbia and Ontario. They've been doing IV therapy the whole time that they've been in practice, and they are requesting to get specialty here. They do not meet the requirements since we are unable to approve both Boucher and CCNM, so they will have to go and take an additional course to practice what they've been practicing up in Canada. So I just wanted to let you guys know that that will be an issue right now with our Canadian applicants.
You can convey our apologies.
I absolutely will. Thank you so much.
Are there any more comments or questions about this time?
And this is Dr. Singleton. I just have a clarification question. This international, I don't remember the name of it, but this additional advanced coursework, does that suffice? Like, if those applicants decided that they just wanted to take that additional course, would that suffice their entire requirements to be approved? Or would they still have to take would someone have to have the basics and then this advanced training? I guess I'm not clear on that.
Now that is definitely a Dr. Osborne question. I'm not sure if the International IV Nutritional Therapy provider would make them go back and take the basic IV course and then the advanced IV course, or if they would just make them take that secondary one. So that is something that I would have to check with Dr. Osborne, but at this point, they would definitely have to go over to the International IV Nutritional Therapy provider to become certified with us.
This Dr. Thompson, it was my understanding from what we had just said that we were not even willing to give them the approval that NUNM has right now because we're unclear on where that division is, and so we can't assess the courses. Certainly, I think that it is worth the IV therapy subcommittee meeting to decide if we want to allow for that sort of a division, like a 2-part certification for these institutions as well, but I think that's something that we can do today because we just don't have enough information.
Sure.
So I'd like to request that we continue to evolve the document we spoke of that we would send to the colleges into kind of a two-part deal once we decide what's what. So it's very clear to everyone what the basic and what the quote advanced is and what they would need to take when they come out if they're coming to California. And so that we could easily approve institutions that are offering the basics without all the extra stuff that they would get in the advanced.
Great. I've taken note of that, Dr. D'Amico. Thank you.
I also have a quick follow-up question. If a naturopath were to open a hydration clinic per se, it would be my assumption that they themselves as the owner would need to have training, or is it just that the providers would need to have the training and certification? Can you clarify that?
So that basically loops in several different agenda items into one, but is certainly an interesting question. So it is my understanding that the person who performs the IV therapy has to have the appropriate training, not the owner of the clinic. What we were talking about separately with the FDA issues was the idea of, you know, people who are not even potentially, I mean, I think the chiropractic example is probably not a great one, but people who are not even medical professionals owning a clinic and having people working there who they are not licensed to supervise. Whereas it would be a different situation if a naturopathic doctor were to open a clinic that provided IV therapy, hopefully not an IV hydration bar that people can just come in and order things, because that's not how we practice, but that a naturopathic doctor could open a clinic and then hire another naturopathic doctor who was trained and provided IV therapy, or another type of provider, maybe an MD would work there who could provide IV therapy or something like that. So that I think is fine as the law is currently written. But the idea is that you couldn't have, so this actually goes to our LVN bill that's going to go into effect in January. What you couldn't have, and this is specifically in the text of that legislation, is you couldn't have a naturopathic doctor who is not trained in IV therapy supervising an LVN who is trained in IV therapy. Does that answer your question?
Yes, so I'm clear about that. And if there were a nurse practitioner or PA or an MD who was the provider, then they would have to abide by their scope and their regulations. Then it wouldn't fall under if the owner of the clinic was a naturopathic doctor. Correct.
I believe so, Rebecca, because even if the owner of the clinic is a naturopathic doctor, everyone is still practicing according to their scope.
Sure.
Correct.
This is Dr. D'Amico. I do believe, though, that if you have a corporation as a naturopathic corporation, you cannot hire an MD or a DO.
An MD or DO could actually be part of the naturopathic corporation as an officer, and they can employ MDs or DOs.
But not as an employee only.
They could, but it would be
you can't be a sole owner or the sole officer. As you have to have an MD or a DO on your board, basically.
I'd have to go back and look at the corporations code, but I I do believe that an ND can hire an MD or DO to work in their practice. They can also be an officer of the corporation, but they can only be a 49% owner. So with a naturopathic corporation, the naturopathic doctor or the group of naturopathic doctors have to make up the majority of that corporation share than the non-naturopathic doctor. So if you had an ND and an MD, an allopathic physician, as partners in a corporation, and it was a 51% naturopathic doctor and 49% allopathic, then it would be a naturopathic corporation. If the shares went the other way, then it would be the medical corporation. Do you see what I'm saying? It's not a 50-50. It has to be a one or the other.
Is the confusion here the difference between someone being an employee and someone taking orders from you? Because MDs and NDs in California cannot give orders to each other, but I think they can practice in the same space together.
Correct.
Getting back to our agenda item at hand, I agree with Dr. D'Amico. I am sorry for our new licensees having to retake the courses, but I just don't think we have another option given what's been provided to us by the Canadian schools. But we can certainly make it a a priority to clarify this for future applicants.
Is it
Great.
possible? Is it possible to? I guess the committee has to approve it, doesn't it? Like we couldn't have, without us all voting on it, we couldn't have the committee compare to see if they meet the basic.
It
There's no
sounds
way
like
to,
it sounds like
for
not
staff
even
to-
Rebecca has that specific data right now because the division that happened with NUNM happened before she was even our executive officer.
That's correct. And that's definitely something that I would, usually contact and check in with Dr. Osborne on.
Great.
Okay, so I've made some notes and that we will go ahead and get some kind of a checklist put together that mirrors our current statute so that nothing is left out, and we will provide that to anybody that is requesting to become a provider for IV therapy with us. So I'll get that together as well.
Thank you, Rebecca. At this point, I would like to call for public comment.
And this is the moderator, and we're opening up the public comment feature of WebEx in case people have comment on the discussed agenda item 6. And there are no members of the public in attendance, so I will close the public comment feature. Thank you.
Thank you so much. So that did not involve any voting, so we can move on to agenda item number 7, which is our executive officer's update.
Great, thank you. And I think maybe we are going to be able to move through this pretty quickly, I hope. So first I want to go over the committee member vacancies. Currently, we have 3 vacancies. We've got 1 professional member. Can you go forward on the slide, please? Thank you. So currently we've got 1 professional member. This is a member, of course, needs to be a naturopathic doctor licensed in the state of California. We've got 1 physician and surgeon position. This can be either an MD allopathic or DO osteopathic physician, and 1 public member. A public member of the committee shall be a resident of the state for at least 5 years preceding his or her appointment. and that the person shall not be appointed as a public member if the person or person's immediate family or manner in any manner owns an interest in a college, school, or institution engaged in naturopathic education, or a person or person's immediate family has an economic interest in naturopathy or has any other conflict of interest. Any doctor or physician that is interested in being appointed as a member of our committee must hold a current and active license in California, free from any disciplinary actions. It's been some time now that we've had these 3 vacancies. Although we have pushed for appointments, we've not received anything as quickly as we'd hoped for. The professional member vacancy has been vacant since 12/31 of 2019, and the physician member vacancy has been vacant since September 21st, 2019. So we are hopeful that we will be getting some appointments soon. We will work with the Department of Consumer Affairs and with our staff that does the social media to make sure that we get some recruitment campaigns going for this. Are there any questions?
Rebecca, this is Dr. D'Amico. Is it for want of applicants or other reasons? Meaning, is that if we don't have enough applicants, then that's a different problem?
So, if from my understanding, we had several candidates put in within the last year. So when we put out our last recruitment effort is when Dr. Mukherjee was appointed to our committee. And at that time, it is my understanding that we got at least a half a dozen physician and surgeons that applied for that position. And I know personally of 4 naturopathic doctors that have applied with the governor's office. So maybe it's just not his cup of tea. I don't know. But at this point, we have not had any of those candidates chosen for appointment.
Do we know that they are no longer be considered, meaning they need a new pool of applicants, or are they still considering a number of applicants?
I haven't even gotten that information back from them. I've just not heard anything back at this point. So since Dr. Mukherjee, we have not had any correspondence with the governor's office, appointments office. So we're hoping that now with all of the elections done, maybe we will get some, maybe we'll get some somebody appointed. So I will definitely be working with the department. We have a new deputy over there that is in charge of board and bureau relations. She's been assisting with some of the stuff, and I know that she's new and she knows about our appointment issue. And I believe she may even be online with us today. And so if Melissa Gear is here, hello, and she is been very helpful, and hopefully we can work with her to get some appointments.
Yeah, I think it would be helpful to know if they're allowed to tell us if there are still people in the pipeline or if they have no one in the pipeline, because that's something we can help with, you know? If they have
Sure.
people that they're considering, they don't need more applicants, and they're busy, that's a different thing, and that's okay. It just kind of tells
Right.
us how active we need to be.
Absolutely, absolutely. So that is one thing that I think that we need to look over to the appointments office to see if they still have those candidates there and if they are still looking at them, or if they just are not, interested in any of those candidates and we need to go out for another pool. So I'll definitely be working with Melissa as we move forward with this and as she gets, into her role over there. So I just wanted to bring this to your attention that this is one of the issues that we're having, with one person out, we still have quorum, but if 2 people have to miss a meeting, we are not able to take action on anything. So I just don't want to have quorum issues. And I know that there's other, programs out there that don't even have quorum. So, I mean, we are lucky in that we have quorum, but I would really like to be fully, you know, staffed. All right. Were there any other questions about this? Any public comments?
This is the moderator, and we do have members of the public in attendance at this point. So I'm opening up the Q&A feature. If anyone would like to make a comment on 7A, the committee appointments, you may raise your hand by clicking on the hand icon, or you may look for the Q&A feature, clicking on the question mark icon, type the word comment in the text box, and click send. And we do have a request to speak from Melissa Gear. So Melissa, I'm sending you a request to unmute your microphone. You're unmuted. Oh, Melissa, we're not hearing you though. You may need to adjust your input device by dropping down next to the mute and choosing a different microphone. Oh, now you're muted again. Let's see. I sent you another request to unmute. You're unmuted.
Good afternoon.
Okay, you're very quiet. Go ahead and speak loudly, please.
Alrighty, sorry about that. Good afternoon. I just wanted to introduce myself for one. I am Melissa Gear, the new Deputy Director for Board and Bureau Relations, and working very diligently with the Governor's Office on appointments for your board. As Rebecca mentioned, we have had conversations about your vacancies and are working very closely with the governor's office to get some good candidates, do interviews, and hopefully get some of those vacancies filled. I would just note that, we get the candidates and then we work very closely with the governor's office and the secretary. And so it's not always on our timeline. There are a couple of candidates that we have seen that are in the pipeline, but timeline, as you may know, takes quite a bit of time. We tell our candidates after we've interviewed them that silence is not always a bad thing, but it could take anywhere from 3 months to 6 months. Some people have been in the queue for a year. So I just want to give you that context. We do everything that we can to move it much more quickly. And to the question about if there are, if there is a pool or if you should be recruiting for others, I would suggest, it's always a good thing to be recruiting at getting more people into the pipeline because then we have a bigger pool and can move a little bit faster because we take into account, just as the governor's office is taking into account kind of board makeup and timelines and when people are going to be coming off the board and needing to come on the board. So sometimes it's people coming on new and they're in the queue and it's like, oh, we're going to move them faster than other people that may have been in the past that we're still waiting on. So it's kind of like there's no hard and fast rule about how the appointments process works and timing. So hopefully that makes a little bit of sense and helps to give you some context as to the process.
Thank you, Melissa. I appreciate that. All right. So I'm going to go ahead.
This is Dr. D'Amico. The board may or may not be aware. I believe 2 of us are scheduled to be off of the board in January. Is that correct?
Give me 1 second. Let me take a look here. I can tell you.
Who are the 2 you're thinking of?
You and I.
Well, I am actually up for reappointment.
Yes.
Okay. I thought you were already on 8 years. Okay.
So
Yeah.
the caveat to that is if you were an appointment that took a place of somebody else's term, then you finish that term out, but you are still able to do 2 full terms. If you came in at an appointment where a term was finished, then you have 2 full terms at that point. So You can't do more than those 2 consecutive terms, but that is how our committee has always been, and I believe that that's still going to continue. I don't think there's any changes to that in our change in the 2685.
So we'll have one person leaving in January.
Let me see. I'm still checking. Hold on one moment. So it looks like, sorry, my computer's being a little slow. So Dr. D'Amico, I'd have to check and see if your first term was an appointment that took over somebody else's appointment, because if it was, then you would be in the same situation as Dr. Thompson. So I will check on that. I'll go back and take a peek and see who you actually came and replaced, or if it was a full term that you took. So I'll look at that, but at this point, those were the only 2 that would be
Okay.
terming out.
I think it was a full term, and if it was, then you will still have a quorum as of January, barely.
Barely, yeah.
Yeah,
Okay,
thank
all
you.
right.
But also,
Thank you.
would that be the end of your grace year, Dr. D'Amico?
Let me take a look. Hold on one second.
Because I've been in a year's grace period this year.
You're doing your grace year before your second term?
Oh, okay.
Yes,
So
'cause
no,
I'm waiting to see if I get reappointed.
so actually, Dr. D'Amico term expires on 1/1/2023, not her grace. So she still has 1 year of a grace. So she has a grace period until 1/1/2024.
Okay.
We're not letting you go that easily.
I'm like, yay, oh, okay.
But I am sure that that
Great.
is one of the positions, that's one of the positions that I'm sure the governor's office will be looking at for the replacement. So fingers crossed that that happens, not too fast, because we really do enjoy you being on the committee.
And I enjoy it too. And, that's good. There's, yes, good measure in all things.
All right.
Thank you.
You're welcome.
And there were no other requests for public comment. Shall I close the public comment feature?
Please do, thank you.
You're welcome.
All right. And can you go ahead and go on to the next slide, please? All right, so I'd like to go ahead and provide an update for the Federation of Naturopathic Medicine Regulatory Authority, and for convenience sake, we're going to go ahead and just call them by FNMRA. Um, so the FNMRA is the Naturopathic Medicine Professions equivalent to the Federation of State Medical Boards. Both are a national level agency that support the state medical boards in licensing, disciplining, and regulations for their respective professional licensees. The FNMRA has a board of directors that are made up of naturopathic regulators from North America. The committee is a member of the FNMRA and has voting rights on their forums. Currently, I sit as the president of the board of directors, where I have had the pleasure of working along the side of the directors from both Washington and Oregon. During the last board of directors meeting, the FNMRA made the decision to support reaccreditation of the ND program offered by the National University of Health Sciences through the Council on Naturopathic Medicine Education, CNME. We also discussed ways to lower the barriers to licensure. As we know, California has pushed for licensing boards to remove barriers to licensure in many ways, such as limiting certain types of past convictions from being used during the application process. This seems to be a similar discussion in other West Coast states as well. There was also a discussion around allowing foreign trained practitioners to become licensed and allowing reciprocity from one state to another within North America. Although this sounds like a great way to assist in closing the gap in primary care practitioners, this has proven more difficult in the naturopathic realm than other healing art professions. Since the training and education for naturopathy and naturopathic medicine differs so much worldwide, most other countries do not meet the educational standards that have been standardized in all North American regulatory boards. We also see this challenge when looking into reciprocity between the regulating states, since each state's prescriptive authorities are so different. We will continue the discussion about reciprocity since this is something that many boards and bureaus under the department are looking into right now. The FNMRA has their most recent annual members meeting on 11/9/2022. During this meeting, the regulators discussed some of the emerging trends, challenges, and regulations that have identified in their respective states. Some of these challenges included the hydration clinics or drip bars, prepaid packages. Many chiropractic boards have been having issues with this, and their boards are taking actions. But some NDs are seen doing this as well. Concierge medicine or retainer medicine is also becoming a little bit of a challenge. This can easily blur the line between a doctor and an HMO plan. In California, NDs have been contacted by the Department of Managed Healthcare about possible violations for the concierge type medicine. Since the conversations have started regarding non-pharmacist compounding and the IV hydration clinics, we wanted to ensure that NDs are represented in these discussions since both in-office compounding and IV therapy have been occurring in naturopathic practices in California and beyond for decades, with very few violations or harm to patients. Lastly, the FNMRA is checking with all of its members and non-members to see which states are tracking IV and advanced injection therapies violations separate within their enforcement actions. Are there any questions about the FNMRA update? Okay, seeing none, I'm going to go ahead and move forward and we can just take public comment at the end, I think. All right, so go ahead and go to the next slide, please. Oh, sorry, I forgot that that one was even there, so we can go ahead and move to the next slide. Thank you so much. So we're going to look at the renewal form transition to a postcard notice for ND license renewals. Please go to the next slide. Thank you. So in order to reduce postage costs and in order to save a tree or two and contribute our part in going green, the staff has been working with our Breeze business integration analyst to change our renewal process from a 10-page renewal form to a renewal notice postcard. The postcard will provide instructions to the licensee on how they can go online to complete the renewal process and pay for their license. I've completed the design of the postcard that you can see in the sample up on your screen now. Since you're leaning heavily into the existing resources to get the legislative mandates met for the new board name and changes to implement those, we have scheduled to debut the new postcard in February of 2023. In order to make this as seamless as possible, we're also adding a section to our website that will assist our licensees in registering an account on the Breeze and linking up their license records. Does anybody have any questions about this? This will actually reduce the time that it takes for a renewal. Currently, a paper renewal with a check takes a minimum of 15 business days to process, and that gets under some of our licensees' skins when they send it in a week before, and there's nothing we can do because it has to go over to the accounting office to be processed for their payment. So in terms of a renewal postcard that goes out, and if they go online versus a paper application, it's usually renewed within 24 hours. So it will definitely reduce the time in their renewal process. Any questions from our committee?
This is Dr. D'Amico. First, I want to send a virtual thumbs up. I think this is great. I'm really excited about it. Well done. And then on the flip side, once a person has renewed their license, are they still getting a paper license?
Currently, yes. We are still looking into going to the virtual, the e-license, and that is for more security and fraud prevention. And I know that we've discussed that in prior meetings. So when we get closer to that time of transitioning to the electronic license, I will definitely bring that back to you guys.
Just something to consider. I know that some other states actually just send an email of your license that you can print yourself if you want a paper copy.
Yes, and I think that there is currently a way to do that, so that if a licensee needs to send that as a verification somewhere, they can. However, a lot of times they won't even take copies of paper license copies anymore. They will go to verify with the actual board or regulatory agency. So there are some drawbacks to a paper license these days. You know, that they get lost in the mail, somebody can get it and go and pretend to be you, you know, or somebody that gets a revoked license still has a license that says that they're a licensed naturopathic doctor and they're out there, you know, still practicing. So there are some drawbacks to that paper license, and that's one of the reasons that so many regulatory authorities are going to the electronic license.
Okay, just as it might be a worthwhile in-between step, remember that many naturopathic doctors have to send, quote, a copy of their license to different vendors in order to purchase supplies or medicines or supplements. And maybe they will all change and go online as well. But it doesn't hurt if sometimes people just want something they can carry in their wallet to just send a PDF. And then you
Sure.
don't have to
Yeah.
print it out. I mean, it's a possible interim step. So something to consider.
Okay, perfect. Thank you. Okay. Any
This
other
is Dr.
questions?
Singleton. Yeah, quick question. So within the 10 pages, I just renewed my license. And within the 10 pages, there's like a summary sheet of what we can and can't do, essentially. Can that be maintained either on the website or somewhere in the application process, just so people can be reminded of that? Because I always find that to be helpful, even though we know, but it's nice to have a reminder.
Sure. I will look into that just to make sure that we keep all of the pertinent information, even if it's on the website or the, you know, the online renewal. But yes, I will definitely make sure that everything that is currently in our paper renewal transitions over so that nothing's getting missed.
If the applicant is going to be notified that they have been relicensed, I'm assuming by email, then those could be provided with that email.
Sure. And I want to say that the important information notice goes out with the renewed license, if I remember right. Okay, any other questions? Okay, well then I am going to go ahead and go on to the next slide. And this is going to be the wind down and end of California state of emergency. Governor Newsom, I'm sorry, something.
Rebecca, it's Dr. Thompson. I just want to point out to you that it is 1 o'clock, which is when we're supposed to take a lunch break.
Okay, well, yes, then we are definitely not going to get through this in the next minute. So I will go ahead and put a pin in this and we will come back to this after our break.
Okay, great. Yeah, we had high hopes of getting through our meeting prior to the lunch break, but it just looks like we do not have that option. So we are going to adjourn. Everyone take your bathroom break, get your food, and we will be reconvening at 2 p.m.
Would the committee want to take a shorter lunch break?
Give me 1 second on that, Dr. Demetri. I'm just checking with staff only because with state staff, we have to make sure that everybody's compliant with union regulations and all that. So I know we have a couple of our staff that says they're okay with a 30-minute break, but I'm making sure that that's actually okay. So just give me 1 second.
And this is Dr. Thompson, and I would just say that I cannot be back on before 1:45, unfortunately. And we can't have anyone out because then we won't have quorum.
Sure. Okay. Well, then let's go ahead and do the so they said that the union contract says at least 30 minutes. So if you guys want to do a 45, and Dr. Thompson, you're okay with that, we can come back at 1:45. If not, then 2 o'clock it shall stand.
Is everyone okay with 1:45?
That sounds great to me.
Well, I
Yes.
guess it needs to be 1:48 now.
That's fine with me.
Perfect.
Okay, thank you.
All right. Thank you.